It's Wendy Bowen, physiotherapist, with a little bit of Know Your Body Better. I wanted to talk with everybody about arthritis because I get so many people coming into the clinic telling me they have arthritis in their hips, their knees, somewhere or another. Well, the majority of people might have degenerative changes in their joints. So when I think of arthritis, I think of arthra means joint, itis means inflammation. So what happens with our joints, we're going to take the knee, for example. So the knee, we have the tibia here, it's got the surface here, meniscus. This surface is a cartilage, and on the cartilage, the really smooth surface, if you feel the bone, cartilage is like a shellac over top of that. And over time, when we have too much pressure, we can get wear and tear on that. It's like the buildup of friction. So if you take your hands, put them together, rub lightly, not too bad. But if you take your hands and really squeeze and rub, you get a lot more friction, warmth, inflammation. So that's the itis part of arthritis. Now what happens, if you think about it, if a joint is supposed to slide and glide nicely in there with a shellac covering so it doesn't hurt, if that wears down, sometimes we have trauma that breaks it down, sometimes it's just compression. And a lot of times what we find is people with arthritis pain, I'm going to put that in quotes, arthritis pain, when we release the tight muscles and the tight tissues around the joint, the pressure gets released and a lot of the pain can be diminished. 50% or more of the pain can be coming from the muscles and the surrounding tissues. So what do you do then for arthritis? Well, one, we release the tight tissues through rolling them, stretching them, as I've shown at other things. I've done a lot of IMS and sometimes some shockwave therapy to release those tight muscles. People also will do a lot of massage to help release these tight muscles. So if you get told you have arthritis, it doesn't mean that you have to have the pain that people think is coming from arthritis. Remember, if you could relieve your arthritis pain by 50% or more just by stretching the muscle, massaging the muscle, rolling the muscle, or having the muscle released by one of your healthcare practitioners, would you do it? So you don't have to live with an arthritic pain in your joint. Look at the muscles first, then see what's left in the joint. So it's Wendy Bowen giving you a little tip on arthritis pain.